Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Sinusitis, and we are looking at the symptoms. So the first main symptom will be pain. So there is pain, and the pain can be present over the upper jaw, as well as it can be aggravated. It is aggravated upon stooping, as well as coughing or chewing as well. Next is the constitutional symptoms like malaise and fever. So there can be malaise as well as fever. There can be headache. So there is headache. Headache will be present in the frontal region. And then comes the nasal and the post-nasal discharge. So there will be a nasal as well as a post-nasal. So nasal, post-nasal discharge. Then there can be redness. So redness is seen on the, so this redness, it is seen, and also edema. So redness is seen as well as edema. They are present on the cheeks. And there is tenderness on pressing over the anterior wall of the antrum. So there is tenderness as well on pressing the anterior wall, on pressing the anterior wall of the antrum. Now, what are the symptoms of the frontal sinus? So what we saw now is the symptoms of the maxillary sinus. So next we move on to the frontal sinus. So frontal sinus, it can present with the frontal headache, and it is also known as the office headache with a characteristic periodicity, or office headache. It is characteristic with the periodic. So it is periodic. That is, it starts in the morning and gradually increases and reaches the peak in about the midday. So it starts gradually and peaks during midday. So the peak is seen during midday. And then it starts subsiding. Next is, there can be presence of tenderness. And tenderness on pressing the floor of the sinus, frontal sinus, just above the medial canthus. So on the floor above the medial canthus. So it is on the floor of the frontal sinus. Press on the floor of the frontal sinus above the MC, that is the medial canthus. Next is, in terms of frontal sinus, there can be nasal discharge as well. So there is nasal discharge. And there can be edema. So edema, if you see, it is present in the upper lid. Then we look at the ethmoidal sinusitis. So ethmoidal sinusitis. So ethmoidal sinusitis is nothing but the pain over the bridge of the nose. So there will be pain. So this pain is seen over the bridge of the nose. So pain is seen on the bridge of the nose and deep to the eye. So bridge of the nose and deep to the eye. There is increase in aggravation by the movements of the eyeball, by the movement. And this is the movement of the eyeball. Next is, there can also be presence of the nasal discharge. So all these are features of the ethmoidal sinusitis. Lastly, we look at the sphenoidal sinus. So sphenoidal sinus, it includes headache. Headache is seen in the occiput or the vertex. And there is also post-nasal discharge which is seen. To learn and grow daily like this, please do subscribe.